very dangerous disease. Inara, a 9-year-old girl, was rushed to the hospital after experiencing a seizure at home. At the age of 5, she was diagnosed with acute lymphocytic leukemia. It was suspected that the cancer had spread to her brain, and an MRI scan confirmed it. Inara fell into coma. As a doctor, how would you break this bad news to the patient's family?
I will avoid medical terminology, and I will repeat the important points because patient who is shocked, actually he cannot remember everything. And I will give the patient time to express his feeling, and I give him the support. And I will answer his questions.
How would you act when conveying this bad news?
From verbal communication, non-verbal factors such as eye contact, body posture, and facial expression also plays a major role when delivering bad news. In Inara's case, imagine if we are the doctor. How should we act when delivering the bad news to her parents? Of course, we have to maintain a reasonable eye contact and be mindful of our posture. This shows that we are approachable and we are trying our best to help Inara.
Getting back to the scenario, the oncologist found that Inara was at the last stage of leukemia, and sadly nothing could have been done to save her. As a compassionate doctor, how would you comfort the patient's family?
I think the most important thing is we have to become a good listener. Most of the patient family are trust and reliant on their doctors. The second thing important is maybe we can tell them some similar situation that we have encountered before and tell them that we know the feelings. Maybe give them some more support. Try not to let them blame themselves too much because they have did their best to their doctor.
Her mother, on the other hand, wanted Inara to be discharged from the hospital. She and both her family believed that Inara should spend the remainder of her days with her loved ones at home. So what's the patient's autonomy in this situation?
First, communicate well with patient. Second, make sure patient fully understand the condition without convincing them. Third, understand the patient's environment. Fourth, give time and space to patient. Fifth, respect patient's decision.
Acknowledge that you cannot imagine how the family feeling. They don't want you to pretend to understand, but they appreciate your honesty. Ask them what they need, although they don't know what they need. Sometimes asking might be helpful. Give them the space and time they need. Let them know who they can contact after they left the hospital. And finally, don't judge. Act professional.
And now, what about the patient's rights? Does the family have any say in this?
The parents have the parental right to make medical decisions for their child. The refusal of further treatment decision should be respected. As a doctor, effective communication to understand the reason of patient's refusal, followed by clear information about the consequences to facilitate the decision making is very crucial. We, as a doctor, should always provide the best care to the patients.
Since Inara is a minor, her family can essentially make all the decisions for her, as well as receiving treatment or not receiving treatment. As long as this doesn't go against the doctor's advice or the patient's wishes, any disagreement can be resolved in court. In addition, they also have the right to change their doctor.
The truth is, physicians only sometimes cure a disease and only oftentimes relieve an ailment, but they always comfort their patients. Such was stated in an article by William E. Cayley. The same can be said for little Inara's case. Thank you.